So today we will talk about the dengue. As you know, there is a recent spike in the dengue cases basically in Punjab. So that's why we are talking about. So how we will proceed? Why in news? Why there is a spread in dengue? What is the transmission criteria, or is there is a mosquito or something like that? And what are the main symptoms and the treatment of dengue? So this is very important video. So let's watch. So if you talk about the why in news, then recently there is a spike in cases of the dengue cases in Punjab due to the various factors. So we will talk about the factor. So what happening that so there is as you know there is a mosquito known as the Aedes aegypti mosquito, that is the female mosquito, and basically the criteria to July to November. So in this period this mosquito has breed. Why breed? Because in this period the temperature not go below 16 degrees Celsius, either the 60 degree above or more, even it heat sometime. So that's why here is the July and then November. So in December, as you know, sometimes it went to 10 degree or sometimes to 12 degree in north areas, especially the Haryana or Delhi and Punjab, and even in somewhere UP or Bihar as well. So that's why. So this is the breeding period of mosquito. So dengue is very seasonal. Why seasonal? Because it spread basically in the July to November. This is the main criteria of dengue spread, and that's why you've seen in recently that there is a dengue spike, and that's why Delhi government in this time advertise in the TV newspaper as well, 10 days 10 minutes or in a week. So that's why. So this is very important. So what is the reason for the dengue spread? Remember that what happened recently, we shown that there is a delay in monsoon frequently in news. So as you know, that's lead to the Kerala flood as well in basically the Idukki area. So at that why. So here is also effect. So delay in monsoon withdrawal lead to carelessness. As you know, sometimes people know that yes, this is the month where we have to be careful about the dengue. But due to the delay monsoon withdrawal, which lead to the carelessness on the part of the people, and they done very carefully about their surroundings, and that lead to the storage of water in their surrounding, and that lead to the spike in dengue. Because dengue bite on which when there is a storage of water somewhere, and that water should be either pure or either dirty, so that lead to the breeding area, and that breeding area contain the dengue. So that is due to the carelessness of the people in the delay of monsoon period. What happened? That led to the dengue spike in Punjab. Another is very important is the garbage. Why garbage? Because as you know, there is a garbage collection took by the municipality, and they put that garbage in some particular areas where they are recycled, renew, or something that like reuse. So that what happened that, so there at that time there is a plastic bottles, in that there are some glasses, plastic glasses, as you know, which used for tea and something like that, and there are the juice cans, coconut shells, and etc. So these sometimes filled with water, which is quite dirty, and sometimes can be pure. So that leads to that when mosquito jumps into that and then touches the body with someone, so that here is the, suppose is the plastic glasses with the garbage, so that mosquito actually breed here, and then this lead to this. So from then they fly up to 400 meters and then touches the someone's skin, so that spine the body, or that lead to the in the body. So if there is a body, so this touches into the body and then lead to touch with the blood, and that causes the also dengue. So this is the one of the reason, and filled with water help mosquito to breed was one of the reason. So more testing is this time, although this is a positive point, but how the more testing contribute? Because if there is a more testing, the more if there is a cases, then it will show. So that's why more testing this time is also, which is a good point as well. But this is more testing is one of the reason for the spread. Now the most important part is the transmission. How dengue causes and what is the transmission process. Remember that. As you know, the transmission, the bite of female Aedes aegypti mosquito, which actually contribute to the dengue. Remember the keyword, the female, not male. It's a female Aedes aegypti mosquito. This is actually when they bite. So when they bite this someone's skin, suppose if there is a this is a mosquito, female Aedes aegypti, when this touches to the skin, so that spine lead to the touches with blood and then lead to the dengue in the body. So these are the basic principle, and remember that this is a daytime feeder. and daytime fever and cannot breathe below 16 degree, and that's why this is the season, and that's why dengue spread is basically seasonal in nature. This is very important point. So remember that till today I am talking about, when I am making the video, no person to person transmission can take place. This is a specific of the dengue. So till today no person and person transmission is there, so that's why. So this is another important point, that because it can be harm. So remember that this can only be spread through the dengue, so dengue mosquito. So remember that. If we talk about the test, which kind of test to find out if there is a person is infected with dengue or not. So remember that there are the two tests, is the immunoglobulin M and immunoglobulin G is the basically antibodies test. So remember that it is the antibodies test. And one of the important tests, that is the NS1, is an antigen test, is basically also known as the ELISA test, which to find out that is there is a person infected with that mosquito or not, or either there is dengue in the person or not. So this is, remember that this can also be used in the keyword, or sometimes asked that this is sometimes find in the news, is related to what. So remember that antibodies test, this is the two important, is the antibodies, and if there is a NS1 found, then this is the antigen test used to find basically is there is a person is infected with dengue or not. So if you talk about the symptoms, obviously there is a sudden rise in temperature when the body found, if there is a sudden rise more than 98 degrees Celsius, if there is a 100 to 103, and even there should be a continuous, so at least there for the 2 days or sometimes 7 days, because sometimes it found to be a normal fever. So if there is a high fever and obviously the headache, or if there is a pain in body, especially the knees, etc., and weakness found in the body and itching, so that lead to the symptoms. So obviously there are one symptom, if there is a decrease in platelets below the 10,000, that is, but when that time you will be hospitalized, and this is not in your hand, so that doctor will found. So this is very important. If we talk about the treatment, that's where there is two important point need to remember. There is a no specific vaccines and no specific drugs. I am talking about no specific vaccine and no specific drugs is available for treatment of dengue. Very important point and key point, that there is a no specific vaccine and no specific drugs is available for treatment of dengue. So obviously there are the ways which need to handle and to cure the drug. So there are the basic medicines like the paracetamol, as you know, and there should be a penalty of water should be provided, and that should be warm, and juice, milk, that should be warm, and soup water can be provided to the patient. So this is basil leaves tea, popularly known as tulsi, neem leaves, popularly known as, you know, neem ka patta, is can be. So these are the curative steps. There are also the two preventive steps, that people should avoid the storage of water, especially the dirty or pure water in their home and as well as in their surroundings. So this is very important, and if there is anything which is beyond your storage, then you should call the municipality that you should take out this water from this area, so there will be no dengue spread. And one important point is that, so before, when there is a season came to July and November, there should be a smog. The smog should be spread through the municipality, so that are the two preventive steps. After that, there should be a mass testing should take place, and these are the steps which you need to take prevent dengue. So this is all about the dengue. 2 to 3 things you need to be very important, that dengue is a seasonal actually kind of thing, and remember that basically between the July and November, and this is spread through the Aedes aegypti mosquito, that is female mosquito, and daytime feeder, and this female mosquito cannot breed when the temperature is below 16 degrees Celsius. There are the two very important tests, IgM and IgG, which is the antibody test, basically find out to dengue, and S1 test is the antigen test, also known as the ELISA kit. ELISA is the kind of popular kits which is used to find out the infectious diseases in the body. So this is basically, so this is the ELISA test which detects if there is any virus, parasite, etc., or anything like that. So this is known as the treatment. In that, there is no specific vaccine and no specific drug is available for the treatment of dengue. This is very important. Symptoms, according to me, it will not ask in any examination. So this is the two important point, and there is a no person to person transmission will take place during the dengue. So this is all about of this video.